is the page from the circular that's relevant to your position. Do you see that?
Yes,
On the
Councillor.
left-hand column, it says Director, level 13, SMS level 13.
Yes, I see that.
And is it correct? I heard you say earlier that you are at level 13.
That's correct.
So the salary band for a director begins at 898,743 rand at the lowest rung, and it goes up to 1,058,000 rand 691. Do you see that?
I see it.
So that's the salary band, and you are located somewhere in there, somewhere between 900,000 and just over 1 million. Is that correct? Is that correct?
I am the director. That's correct.
So then in relation to Ella 83, do you have that in front of you?
Yes, I have.
It's the title of the document is Gauteng Provincial Legislature Reply, and it's within the Health Portfolio Committee in the Provincial Legislature, and it's from the MEC for Health, and it's to all members of the legislature in reference to question 5, HL067. It's also dated at the top of the document, 14 August 2017. Can you confirm that?
Yes, I have the bottom one. The one at the bottom, the second page.
No, I'm just reading the document into the record. So I'm just describing what the document is for now, and I'm just confirming that we are both on the same page.
Okay, that's correct, Council.
Dated 14 August 2017. You see that?
Yes.
If you can turn over the page. Under or next to Roman numeral 1, the question is, which officials have been suspended with pay? And that's a reference to officials implicated in the transfer of Esidimeni mental health care users. And can you tell us which officials have been suspended with pay? What does it say?
It refers to Dr. Silubane and myself.
So there are two officials who have been suspended with pay, Dr. Salabano and yourself.
That's correct.
And next to Roman numeral 2, it says, the question is, on what dates were they suspended? And in relation to you, the date is 15 February 2017. Is that correct?
That's correct.
And then Roman numeral 3, which is the third question. The question is, how much in rands and cents has been paid to each of them since their suspensions? For Dr. Salabano, who was suspended on the 8th of February. So this is between February and July. For Dr. Salabano, the amount is 784,000 rand, 784 and 39 rand and 56 cents. Do you see that?
I can see it.
And in relation to you, Dr. Manamela, the amount from 15 February until July 2017 is 385,269 rand and 1 cent. Is that correct?
I see it's written here.
Do you agree that that's what you've been paid between 15 February and July?
I didn't make calculation, but if it's written here, what do I say? It means they calculated from HR.
But you don't know whether this is correct. Do you not know what you get paid every month?
Come again?
You can't confirm whether this figure is correct or not.
What I know is that I'm still on being paid, so I'm not quite sure because I didn't work out the figure. So if they put the figure to you, then it means that's what they gave you, so you can use
Well,
it.
if we're a bit conservative and divide 385,269.01 by 6 months, assuming it's inclusive of this period of February and July, it works out to about 64,000 rand a month. Does that sound right?
I can't answer that one. I told you I can't answer for my salary. I can't answer that one.
Are you saying that this number is incorrect?
I'm not saying it's not incorrect because I didn't calculate myself. And I don't get pay slip because I'm not in the hospital. But
You don't get a pay slip. How do you get paid? Does it get paid into your bank account?
Yes, it's the bank account.
So is this the amount that you've been paid? It's a yes or no. Does it look right to you? It doesn't have to be down to the 1 cent. I mean, they've gone down to the very cent.
If the department says that, it means they worked it out. So what do I say? I can't say they didn't work it out.
That's not my question. I'm not asking whether the department worked it out. I'm asking whether you can confirm that this is correct.
It means it's correct if they say that.
So you confirm that that is the
Because I
amount?
didn't work it out. I can say if they say that is correct. So that's what I can say.
It is correct.
I don't understand what the problem is, Dr. Manamela. You know, salaries of public officials are gazetted. If you want to know what I earn, you go to a government gazette. You can Google it now. You go to a government gazette, it will tell you what the Deputy Chief Justice of South Africa earns. You want to know what the Chief Justice, you want to know the President earns? It's a transparent system.
That's why
So I don't know why we're spending so much time.
Justice, I don't have time. If she can take it as that way. What I said, I didn't work it out. That's all. But if this what is there is fine, it's there. So I don't have a problem. But I couldn't say anything
We are
because I
public
don't know.
officials. Our salaries are a public matter. They are known. If you want to know what I earn, you can, just like that. The President earns just like that. You get into Google, get into government gazette, the salary is there. So why are we struggling like this?
Don't have to.
Okay.
So we accept that these are the correct figures. What I want to stress, Dr. Manamela, is that I'm not putting this question to you in a frivolous manner. It's relevant. And it's relevant for the following reason. You hold a senior position as a public servant. The salary indicates the seniority of your position. And so it's important that we are able to get answers from you as to what happened during the marathon project. That is why I'm putting this to you, not to be frivolous and not to harass you. This is a salary level, as I said, the lowest rung is about 900,000. You've said that you've tried to place responsibility on a range of other people. Either you are too senior to have done something that's left to teams on the ground, or you're too junior to take responsibility. And so that's why I'm putting this to you, which is to say, it's a senior position, it's rewarded handsomely, it's a public position, and so you must have been responsible. Would you agree?
I've never refused where I'm responsible. I've indicated my responsibility to you.
Well, you tried to evade your responsibility.
That's how you see it, Justice. It's not what I said to you. You asked me what is my responsibilities. I told you.
Yes, except that you don't take direct and individual responsibility. That was my question. It wasn't about putting teams in place. That was the question we left off before we broke for lunch. It wasn't about putting teams in place. It was about ensuring that things worked properly and that the buck would stop with someone.
I told you that in the mental health unit, I'm responsible to ensure that mental health services in the province are functioning effectively and efficiently. That's my role. And I also indicated to you my role in terms of the project.
So if your function is to ensure that mental health services function effectively and efficiently, would you say you succeeded in that during the marathon project?
During the termination of contract relationship between Gauteng and Life Esidimeni, my responsibility of ensuring that things are put together, starting with the life, with communicating with Life after I got the termination, convincing the team, the task team, getting the finding.
But we now know with hindsight that it wasn't effective or efficient. Isn't that so?
Yes, can I finish? Because I'm just giving you my responsibility, ensuring that the hospital who will get patients are involved, and then signing those licenses. At the end, what you are saying, there were challenges, which I've never said there were no challenges.
Okay. So it wasn't effective and it wasn't efficient. Were you warned of the challenges that would come?
Were
you warned of the risks of the project?
If you look at the project plan, there are risks that we have indicated. We were meeting with people, they indicated that we need to be careful. And that's why we had to have the risk indicated that this is what we are thinking, that we must guard against so that the patients are well taken care of. So some of the areas where we were warned, it was not myself who can take everything that people were warning about. Because
were you warned of the risks is the question.
The department were given letters. The project team manager were given letters where I was also a deputy to say, you must stop the project.
Okay, let's do that. Let's go there. Let's go there to the warnings. Let's just be a bit precise. Isn't it correct that you were warned? Let's just start here. The termination took place in September 2015. Is that correct?
The notice correct.
And you were warned by the clinicians on 28 April 2015. So well in advance of the termination.
Can we get the response of the witness? I know you have a lot to chew there. Were you warned on the date that Council has just mentioned?
Yes, the date was, the letter was written to the department, and I was also given that letter during April.
And it 28 April 2015.
Yes, when
well
we were
in
still
advance.
busy with let me finish. When we were busy with planning team.
Okay, I'm not asking you any more about teams.
Okay.
I'd suggest it's better you don't talk about teams any further. I'm asking about your role. So 28 April 2015, you confirm. Can you please open the file with the Ombuds report? It's Ella. It's King, if you can please assist me. It's the Ella file, and it's Annexure 8A of Ella 2. Ella 2, Annexure 8A. It's page 41.
Page 41.
Do you have it?
I'm still checking.
Page 41 you're taking us to?
Page 41, that's correct.
Yes, I found it.
And this is the letter 28 April 2015, the first written warning. Isn't that so?
No.
Excuse me.
Specialized in disposition of unaccountable power.
41. It's affidavit.
It's Ella 2, so it's annexes to the Ombuds report, Justice.
Volume 2.
Okay.
And it's page 41 of Ella 2.
It's not this one.
Okay.
Have you found it, Justice?
That's the memorandum to Dr. Manamela.
That's the memorandum.
Thank you. I have.
Have you found it, Dr. Manamela?
Yes, Councillor.
And it's addressed to you.
Yes.
And it's dated 28 April 2015.
Correct.
And it's by several professors and doctors, psychiatric professionals.
Correct.
Can I ask you to look at page 4? I'm not going to go through the entire letter. We've been through this in these proceedings before, and I'm sure you're aware of this letter. Are you aware of this letter?
Yes, Councillor, I'm aware of the letter.
So at page 4 of the letter, which is page 44, paginated page 44, under the heading Financial Implications, the clinicians say the following. We were informed that the main reason for the accelerated discharge of patients from Life Esidimeni is to reduce healthcare costs and thus contribute to expenditure reduction within the provincial government. As discussed in the meeting, we respectfully submit that the process being followed will in fact escalate and not reduce direct and indirect healthcare costs, and then they provide their reasons. Do you see that?
Yes, Council, I see it.
I'm going to put a question to you now, but I just want you to have regard to the following paragraph before I do so, and that's in the conclusion, and it's the second paragraph, in which they say, we note that this decision will have a devastating impact on the health and social well-being of mental health care users, the healthcare system, and members of the community. We also note that this decision will likely escalate healthcare costs in our province. What was your response to this, to these concerns?
Thank you, Justice. Thank you, Councillor. Upon receiving the letter, because we're meeting every 2 weeks, I advised the clinicians that the letter was misdirected to me because I didn't take decision of that termination, of that reduction of beds, 20 reduction. It was on the policy of 20%. So I advised them to redirect the letter to the leadership. And what I noticed later, they were all part of the leadership or of the project team. And in the meeting in the project team, none of the people who wrote here has ever indicated in my presence to the leadership, MEC, HOD, and the other team members that this is going to be a devastating process.
What are you saying now? I don't understand this. You received the letter. Let's take it in small parts. And that's the only way you feed on an elephant. This is an elephant. Body, they say in Swahili. Piece by piece. You received the letter.
Correct.
And what did you do with the letter?
Excuse me. I received the letter.
Yes.
As they have opportunity to meet with me 2 weekly, I advise that as they see the leadership this letter, this part must be taken on with the leadership because I didn't make decision to reduce the 20%. That's when we're still working on 20%. So that was what I advised them about when I received
this letter is of the 28th of April, 2015.
Yes. We have not yet busy with termination by that time.
Did you write back to them? You are the main recipient of the letter. Did you write back and say, sorry, wrong address.
No, I couldn't because I was going to meet with them the following week because we were meeting every week. So I indicated to them that that letter, although you did CC to my leadership, you should address it to the leadership that took decision because I showed them the letter that was signed by HOD that...
But they'd already sent it to your leadership. So
yes.
What are you saying? What are you saying now?
Well, what I'm saying in short, because I was not in power to organize the meeting for them with the leadership. So that's why I advised that it should have been to HOD, CC, Dr. Manamela.
But
then I will take it.
They've done that already.
They've done that.
Look at the letter.
The letter said to Dr. Manamela.
And
it was sent to me, and then CC the leadership. So that's why I said in the meeting where we were meeting, the letter was misdirected. Can you direct this letter
Anyway,
to the
Councillor
relevant
wants
So
to
your answer,
Go ahead.
Justice, the answer is it's not my department. Address your concerns elsewhere.
No, I didn't. No.
Is that not what you're saying?
It's not what I'm saying. I said to them, the 20% reduction is not coming from Mental Health Directorate. So I will be unable to answer. Let's direct this letter to the leadership, the HOD, who signed the letter to say we are reducing by further 20%. And we were not fighting. We agreed.
So you're saying that the
meeting.
decision to reduce, to transfer patients from Life Esidimeni was not your decision. Therefore, the letter was inappropriately addressed to you. Is that what you're saying?
That's what I'm saying, because it was responding to 20% reduction of beds.
So you said to the clinicians that they should take their concerns to whom, if not you?
I said to the clinicians, the letter that was sent to Life Esidimeni to reduce for further 20% does not come from my office. So this letter, it will be proper if it's directed to the executive of Department of Health in Gauteng.
Okay, that's sufficient. It wasn't your concern. Could you please turn? You see, Dr. Manamela, it doesn't matter whether you say it or not.
Yes, but
it doesn't matter because you're being evasive. I ask you the question. You've repeatedly said that you've said to the clinicians that they must direct their concerns elsewhere. Is
true.
that so?
That's
okay.
true. Justice, not
Meaning
elsewhere, because you need to understand how government work.
No,
it's not like private entity. That's how the government works.
What is how the government works?
The government.
You point fingers at each other.
Oh yes, the government. How the government works. If there is a decision has been made in a particular area, that particular area is above where the implementation will take place. The letter should be redirected there, and they will call me, and then we can discuss.
So you were not responsible for the implementation?
We were not even started with the implementation at that time. It was just us starting with the meeting. Everybody was free to indicate what do they think about the project.
Did you agree with the concerns of the clinicians?
There are areas where I agreed with the concerns of the clinicians, and we were working together to say let the letter be directed properly.
Not to you.
Yeah, it was not supposed to be directed to me.
Okay. The second warning before the contract was actually terminated.
But before you go to the second warning, once you've seen the contents of the letter, which parts did you agree with?
We had a mental health care policy that we were still working on. That is what we were trying to identify where those patients who are discharged from Life Esidimeni at that time.
I'm asking about the letter before us. take me to parts and paragraphs where you agree with the letter.
I will need to read some paragraph because I just saw this letter as it's indicated now and I have to answer it. I agreed with the paragraph that said it was therefore agreed that an urgent meeting with the Honorable MEC held. I don't know, the last but one, after the last paragraph before the process. It was therefore agreed that an urgent meeting with the Honorable MEC Matlangu should be requested where the issue can be discussed with a view to ensure that persons with severe mental illness that have benefited from care, treatment, and rehabilitation in Life Esidimeni Hospital can continue to receive appropriate and cost-effective mental health care. So I agreed with them, but I was not the person who can arrange the meeting for the MEC. MEC has got his staff to arrange the meeting. That's why I said, from what you are saying, it's better if you redirect this letter to the relevant section and we'll join there.
Anyway, Council, you have to take it. Let me ask just one more question. In the conclusion, do you agree with the part that says that the decision will have devastating impact on the health and social well-being of mental health care users? Can you see that paragraph? Just above the last one?
About the international experience?
No, conclusion.
Okay, can I just look at it? Justice, pardon me?
Conclusion. Above the one you read earlier about meeting with the Honorable MEC.
Above the one I read earlier.
Yes. We note that this decision will have devastating impact on the health and social well-being of mental health care users. Do you also agree with that part?
I don't see it, but I agreed with it.
No, I want you to see it. It's important. Page 45.
I'm using a laptop, Justice.
I beg your pardon?
I'm using a laptop here. I must pushing it up and down.
No, you can use our record. It's volume 1. Page 45. That's what Council referred you to.
This is volume 1.
Justice, while we're trying to locate it, Dr. Manamela, if you've got an electronic copy, it's under the conclusion, the second paragraph under conclusion.
Yes.
Okay, we got it. Which one? Is this it? This one? Okay. All right. Before the conclusion.
Yes. Have you found it?
Yes, I have found it. And
you agree?
That's correct.
It also says, just above the conclusion, that this is likely to result in the escalation of medico-legal claims against our department. Did you agree with that?
That's correct.
And what did you do? If you were in agreement with that, what did you do about it?
Like I was saying to you, Council, that this letter, we're requesting a meeting for all the team to meet with the MEC and present what we were thinking. So, like I said, can you please redirect this letter to the MEC? And then if she called a meeting, I'm willing, I'll be there. They kept on asking me. I said, no, redirect the letter to the MEC. We'll go and meet. The MEC finally met us, but I was not told it was because of this letter.
Okay. So, but you agree with what they are warning you about, but you continued to implement the termination.
The termination was not my decision. And the same...
I'm talking about the implementation.
Yes, the same team that wrote here, they were part of the team. And in those meetings, none of them ever advised anyway according to this letter. So it was not on my position to say, clinicians, you refuse, you wrote this letter, follow up, what. But all of them were there, were given duties, they were coming to.
But what about your duties? You said you agreed with this.
Yes, but that was not my duty to say, because they were coming to the meeting. If they were not...
Was not your duty.
If they were not part of the project team, I will go to the chief director and say, Chief Director, this is the problem. And I briefed her and said, this is the problem, but we advise the clinician to redirect the letter to the MEC. While I'm still waiting for the letter to be redirected, there was a meeting, there was a project team. None of them said I won't take part. Then we went to the meeting, given the delegation, did all what we need to do. And that's why I couldn't action the letter, because the meeting was requested with MEC. I had meeting with them. I know that they were not keen for the determination.
Did you raise a concern in the meetings that this is going to have a devastating impact on the health and social well-being of mental health care users?
It was always a priority to say, if we are not careful, this will have a devastating result. But because the team were working together and meeting the MEC, it was like we will be able to overcome everything, even after placement.
You see, it doesn't make sense, because the reasons why this concern arose was because of several factors, including the need to have already established community-based care, to have already piloted, to have already tested it, and none of that was in place.
Yes, Council.
The concerns that were raised by the clinicians were not concerns that could be addressed in a matter of months.
Yes, Council, you are right to say it doesn't make sense. But it still doesn't make sense. If the very same people who raise concern, they are now part of the team, and they are not advising. So it does also not making sense of what they said in the beginning. Now they are part of the team.
Okay.
They are carrying on
we'll
with
come
the
to the clinicians at another point. I'm actually just asking you to speak about your own duties. That was your first warning. The second warning was in June 2015. And if you could look at file 1. Page 383.
Page 383.
Have you found it?
Yes, I did, Council.
It's a letter from the South African Society of Psychiatrists. Do you see that?
Yes, I see the letter.
And it's June 2015. Are you familiar with this letter?
Yes, Council, I am.
It's a letter from the Society of Psychiatrists, a separate group of psychiatrists, that is, from the earlier letter, who raise their concerns. They detail their concerns in the letter. You've seen it already. And they conclude by saying, we urge the MEC for Health and the Gauteng Department of Health to reconsider the decision to cut long-term care. Do you see that?
Yes, Council.
And what was your response to them?
Like I was with them because we were providing the update to them on 2 to 3 monthly basis. But we were all waiting for the MEC to call for a meeting. So I couldn't just say I terminate the process. We cannot carry on. It was not my call to make. I was with them as well.
So you're aware of the concerns that were raised? And now there have been 2 letters by experts in the field warning you. The decision was nevertheless taken. Is that so?
The department didn't take decision to meet the psychiatrist.
No, I'm talking about the decision to terminate the contract.
Yeah, it was not yet taken. Because the letter was in June.
Yes, my point is you received warnings before the decision was taken to terminate the contract, correct?
That's correct.
The decision was nevertheless taken in September 2015, correct?
That's correct.
And you supported the decision to terminate the contract?
How do you know it's cancelled?
I'm asking you, did you support?
I think I indicated to you that to this proceeding that when the decision was taken, wherever you find yourself as a leader, you check if it's in line with the provision of the prescripts and the quality of the services. And I checked, and I've indicated the acts, the rules, and even the SLA. So I was on no position. You can see it was CCs to national, HOD, my chief director, where I refer.
Did you support the decision to terminate the contract? That was my question.
I implemented as they wanted the decision to be implemented.
Did you implement it even though you did not support it?
I can't answer that one.
Why not?
No, I can't answer it.
Why can't you answer it?
Because I can't answer it because it was within my delegated duty and within my area. It was also within the legal prescripts. So I am unable to tell you my own personal thinking on the decision. Because I said this morning, if the decision was indicated and I found that it's not in line with the regulation acts and...
Do you think it was in line with the Constitution?
According to
if you said already that you were concerned about the devastating impact.
Yes, but nobody in the devastating impact was indicating or was foreseeing that the patient will lose their life like it has. So we were all, the team, trying to work very hard to say, let's make sure, from my department, because we discuss also in my own area, let's make sure that these people, what they're saying, we understand. But if this is given, what grounds do we have to say we're not going to let it carry on? Let's make sure.
The grounds you have are, for now, at least, first of all, your own experience, your own training as a psychiatric nurse. You know about mental health care. You know about how to the concerns that mental health care users would face, the challenges that they would face, as you say. You're aware that it may have a devastating impact. You're aware that you have a constitutional duty to protect their rights. So it's on the basis of those concerns and the experts have advised you. Did you support the decision to terminate the contract?
So, because I cannot just say, because like I said, I said it was a legitimate instruction. And that's why from my unit and from the team, this is the very psychiatrists, we agree, we said we are going to work hard and try our best, smart, to ensure that there are no devastation, except that the SASOP didn't come and agree, but our clinicians came and become the part of the team.
Okay,
So,
so you supported it so-so.
It will be unfair.
We can
for
leave
me.
it there. We can leave it there. So-so is fine. You see, because after the decision was taken, and despite those initial warnings, the alarm continued to sound. So, and let me show you how. If in the same file that's in front of you, that file 1, if you could turn to page 169. Do you see it?
Yes,
Page 169. It's a letter from the South African Depression and Anxiety Group.
Okay.
And it's dated 26 November 2015. And it's addressed to the former MEC Mahlangu, to you, yourself, Dr. Manamela, and to Mr. Mkachwa. Do you see that?
That's correct.
Are you familiar with this letter?
That's correct.
And if you turn over the page, at paragraph 8, Sadag said, Dr. Manamela stated that a review had been conducted in which users were identified and whether they have IDs established. NGOs were also identified. He stated, meaning she stated, that the levels of function were being assessed and reiterated that users would go to families, to NGOs, or to hospitals. Did that happen? Did that take place?
Yes. Users went to families, some to the hospital, some to the NGOs.
Were they assessed? Were there patient assessments?
Yes, the patients were assessed.
And the NGOs too?
Yes, the NGOs were assessed.
And they were assessed as being fit for purpose?
Yes, the report that was sent to me was saying they are fit for purpose.
And at paragraph 10, it says Dr. Manamela stated that families would be supported and a proper project plan would be compiled together with a communication strategy. Is that true?
That's true, Council.
Are you saying that the families were supported?
Yes, I will say the family were supported, although not all of them, because I've indicated yesterday that when we started, 770 didn't have family contact. And by January, March, that to 2015, we commissioned the Health Advance Institute to look at the services at life.
Okay, the
we
services
also
at
realized
life,
50% of the patients.
We can come back there, but that's not the question for the moment.
Those families that we knew about, we ensured that they should be supported. What can be a question is that will they agree, will they become satisfied with the support that we're trying to offer? That is the question.
Okay, I'll return to that. I'll make a note, and I'll ask you that question. I just want to deal with this for now, this letter. And paragraph 11 is a very important paragraph. It has a number of questions that are addressed to you. For example, has the process of assessment and discharge commenced? If so, how many mental health care users from each facility have been assessed? What is the assessment? So on and so on. It goes on and on. Have the NGOs been identified? Which NGOs have been identified? What is the breakdown of beds? It goes on and on and on. Do you see that?
Yes, Council, I see it.
It goes on for pages, up until page 175. What was your response to them?
My response to this was that we will work together as the stakeholder which are interested in mental health care users. We've been working together with SADC and South African Federation. So my understanding was that these are relevant questions that they're asking. We will continuously working together with them and ensure that we deal with the areas of challenges and get their support.
Once you received the letter,
Did you
write back?
The letter was directed to the MEC.
And to you.
And to me, but the MEC is the first person. Because I had meetings.
A short question. We must save time. We're spending many hours with you telling us things we haven't asked you. Did you write back? The answer is no or yes, and then we'll ask you another question. So we need to save time so that we can make progress.
Justice, I will have saved time, and I agree with you. But I have to qualify, because I have a meeting with SADC. Then they wrote a letter. I knew that even if I didn't write back to them, I'm meeting with them in a meeting. So, and again, I knew that the decision, they all knew, SADC, that decision was not made by me. Then in the following meeting, we were going to take them through what we have done.
Okay, so are you saying you provided all that information to them? All these detailed questions they're asking, did you provide answers to them?
I'm not quite sure if all of them, but some of the information we did provide to them when they were still coming to the meeting with us.
Why did you not answer the questions fully? Why did you only answer some questions and only when they were in a meeting rather than responding in writing with an answer to those questions?
I can't remember everything now because it was long ago. But if I go to my office, you can check. Maybe we find that all the answers the questions were answered in those meetings. But because the letter was written to the MEC, at the end of the day, SADC didn't attend meetings with us only. We started to attend meetings chaired by the HOD. And that, to me, was saying is another response from the department to actually engage SADC in this process.
I'll put it to you in a moment that you didn't respond. The next warning came now no longer from the families associations and from SADAG and SASOP and so on. It came now from their legal representatives. And in the same file, if you could turn to page 182, do you have it?
I think I have it.
182. It's a letter from section 27. Do you see that?
I see it.
And it's addressed to you as well as the former MEC, Dr. Salabano, Mr. Moseneke, and Mr. Nkachwa. 9 December. This is following earlier correspondence, which they set out in this letter. And I'm not going to go through it in detail. Are you familiar with this letter?
Yes, Council.
In summary, they say the department, they record the department's contradictory engagements, contradictory minutes, and then in paragraph 13, they say it is still not clear to which public healthcare facilities and NGOs users will be transferred, whether these facilities have been consulted, whether they can accommodate these users, and what services the users will receive. Do you see that? That's paragraph 13. In paragraph 14, they say, we remain concerned that these discharges are in breach of the user's rights, including the right to healthcare services as guaranteed in Section 27 of the Constitution. At the end of the letter, they make a proposal that their clients, together with the department, jointly approaches a court for the appointment of a curator ad litem to protect the rights of the users. What was your response to this letter?
Again, that this letter was not within my capability of function because it's addressed to MEC and the HOD.
And to you?
Yes.
So what did you do? Did you discuss it with your superiors? Did you say, there's a concern here? The rights of users are, in fact, threatened.
The letter was also emailed to the leadership that if you've seen this letter, and they will have to take decision whether they will call a meeting, like I've mentioned. From that time, the meetings that we used to have with SADC were now shifted to be chaired by the HOD. So it was like the HOD meeting.
So you didn't have any concern with this letter?
No, I didn't say I didn't have any concern.
What was your concern?
But my concern, I'm saying, if the leadership were addressing the issue, then I was part of them. I would go elsewhere with SADC.
You were satisfied with the way in which this was being handled? Were you?
The leadership managed the SADC because...
Who are the leadership?
The leadership...
names of people, please.
Political head, the former political head.
I want them on record, ma'am. We're building a record.
Yeah, yes.
No. Let's not be over familiar.
Yeah. I must mention their names.
Yes.
Okay.
We're in a formal hearing, and I want us to keep the decorum going.
You know, I was saying that because the letter is explanatory, Justice is saying to the MEC, Ms. Makgabo, the former MEC Makgabo, Dr. Silibano, and they also want me to know, and Mr. Moseneke, and Dr. Morgan Mukanchwa from Life Esidimeni. So when this letter was written to the former MEC and the HOD, according to the hierarchy of the department, it was not me to say, MEC, we are stopping, this letter is saying that. As a result of this letter...
I understand that. You couldn't give her an instruction. I understand that. But did you say, this is a concern? We need to take it seriously.
Yes, I forwarded as well to say this is a concern from SADC. It needs to be taken seriously. And then for them to call the SADC to the meeting and take them out of the meeting that we were chairing, it shows that they were looking at this as a very critical issue that needs to be ironed or to be solved so that we continue working together.
Okay. And that was on the 9th of December 2015. If you turn over the page 189 of the same file, that's now your lawyers in response. We have no record of you or anybody else from the department responding in writing to say, we are concerned and maybe it's a good idea, let's jointly approach a court for an appointment. Instead, what happens is this letter arrives, page 189, dated 14 December 2015. Do you see it?
Yes, I see it. Cancel.
And can you confirm that it's a letter from your lawyers saying that we represent the Department of Health, MEC? Can you see that?
I can see it. That's correct.
Dr. Barney Salabano and Dr. Makgabo Manamela. Is that so?
Yes.
You were represented by these attorneys?
Yes, yes.
So they were acting on your instructions?
They were acting on the departmental instruction.
So you are one of the clients. You're familiar with this letter. These were your lawyers as officials within the department, yes?
Yes, they were the departmental lawyers.
Oh, they were the departmental lawyers, I see.
Yes, and I'm still appointed by the department.
And in paragraph 5 of the letter, they say, our clients have taken all reasonable steps and in keeping with the various legislative prescripts of the Act to effectively provide both for the discharge and the transfer of the users. Any allegation to the contrary is either self-serving or disingenuous. Our clients have consulted all the health services to which the users have either been discharged and or transferred to. Do you see that?
Yes, Council.
Did you associate yourself with those comments?
We were busy with this process. So I saw it and I realized that this is a true reflection of what was happening at that time.
I don't understand. Okay, let me break it down. It says our clients have consulted all the health services to which the users are being sent. Is that correct? Had you consulted with all the NGOs, with all the hospitals?
Yes, at that time we had already consulted with the NGOs, including the same SADC and the
I'm not talking about SADC. I'm talking about the NGOs to which you were sending mental health care users.
Yes, we have already started around early October. We already started with the NGO. We continued with the one with the hospitals.
And you were satisfied that
it was
the
the
project
work
should
on
continue?
the process. It was the work on the process.
You didn't think it was a good idea to appoint a curator, an independent person to see to the rights of the mental health care users?
I will still take you to the hierarchy where I belonged. Whether I say that or I say not, I was at the lowest hierarchy.
No, I'm not asking what you did. I'm asking whether you felt that. Did you agree? You see, the important thing about this is these lawyers wrote to you, and they were saying, we just do what you need to do. We just worried about the rights of the mental health care users. They didn't say, stop, don't terminate. They said, can we, as a start, just have a curator appointed? I'm asking whether you agreed with that approach or not.
I'm not in a position to answer that one.
Why not?
I was not taking decision.
I'm not asking whether you took a decision. I'm asking
Yes,
whether were you sympathetic to that approach to protect the rights of the mental health care users?
Protecting the right of mental health care user, it has been my priority from the lowest level of my training with mental health.
So
There
why
was no
did
less
you?
at that
So why
time.
did you defend this litigation and say that that should not happen?
A decision was taken, and a notice was taken. What I could
Did
do,
you not agree with this approach then to defend this litigation?
I cannot answer that one. I said that, and I'm saying.
I'm not
it
asking
again.
whether you made any decision. I'm just saying, did you go along with it and not say anything? Or did you raise a concern?
I can't remember what I said, but what I remember is that the project, the termination was not stopped. That's what I can remember. But the discussion,
Who said this termination will not be stopped?
I'm
Who
saying
in the
it was
leadership?
not.
Who in your leadership said that?
I'm saying, I'm saying justice. I didn't hear anybody who say it must be stopped. I'm not saying somebody said it must not, it can't stop.
No, but who gave the orders that the termination go ahead? We know who signed the
Okay.
letter is Dr. Esidimeni.
In the meeting where we were, that were chaired by the MEC, it was clear that the termination goes on.
And Dr. Esidimeni supported that.
He was also in the meeting.
Did he support the decision?
He's the HOD. I'm 2 levels lower than him. He can't tell me if he doesn't support.
Did he support the decision?
He will answer for himself, Chief Justice. I can't answer for him.
Did you support the decision?
For the decision for termination,
Yes.
you remember I indicated that I had to implement it according. I checked the legal.
No. Did you support the decision to terminate? The answer could be no, or the answer could be yes.
Looking at what we have done, like I said, if I didn't support, I will write to the MEC and say, According to the legal prescription of my work and my responsibility, I cannot carry on. I indicated that early in the morning to say I had to take the instruction based on the legality of this instruction.
Did you support the decision?
That is clear justice, because if I carried on and not writing a letter to MEC, it means I supported the decision. We carried on.
Thanks.
Continue.
If we get more answers like that quickly, then we can finish and quickly as well, Dr. Manamela. So December 2015, all of these warnings, you decided to fight it, you continued with the project, and you continued to implement. And you say that you were satisfied with the NGOs. You were satisfied and you licensed the NGOs.
I was satisfied with the report that was delivered to my office by the district through the NGO manager, and I signed them.
Are you aware of your duty when it comes to signing licenses?
I am aware of my duties.
Are you aware that you have a duty to apply your own mind?
Correct.
So why did you just accept the say-so of others?
I did not just accept the say-so of others. There were NGO. If you got the document from me, you will see the one that we gave the ombudsman.